In health news today, prenatal exposure to anti-epilepsy medications has been associated with an increased risk for problems in newborns. Catherine Dolph has more.
Tine Sorensen has lived with epilepsy since she was 15 years old. She is now expecting her second child and continues taking anti-epilepsy medication, including a very low dose of valproate.
When you're treating pregnant women with medication during pregnancy, it's always important to weigh the benefit for the woman with a potential harm for the child.
Prenatal exposure to valproate and other anti-epileptic medications has been associated with congenital malformations and delayed cognitive development in children. Dr. Jacob Christensen from Aarhus University in Denmark and co-authors wanted to determine whether valproate could be associated with an increased risk of autism as well. Researchers followed more than 500,000 pregnant women in Denmark. These women gave birth between 1996 and 2007. Researchers then followed the children to see whether they were diagnosed with autism.
Among those exposed to valproate during pregnancy, there was a threefold increased risk of autism spectrum disorder and a fivefold increased risk of childhood autism.
The study appears in JAMA, Journal of the American Medical Association.
The real advantage of this study is that we were able to adjust for other factors that may be associated with autism spectrum disorder. For example, the age of the parents, the comorbid psychiatric disorders, or the weight of the child at birth, and also the gender of the child.
Researchers found children who were exposed to valproate but without congenital malformations also had an increased risk of developing autism.
So it's always important for pregnant women to discuss with their physician whether they are taking the right medication or they may change to another type of medication that may fit them better.
Catherine Dolph, the JAMA Report.